All families who have children with special medical or educational needs can face challenges, like finding resources, managing care, and coordinating support. Military families face these same issues with added layers of complexity and stress because of the unique demands of military life. For example, relocation. Most military families receive orders to relocate every few years. This permanent change of station, or PCS, means the family will move and start over in a new location. For families with special needs, this means finding new medical providers and navigating possible changes in insurance. It can take time to sort it out, which can cause a gap in support. For families with school-aged children, relocating means new schools. And school systems may differ in how they manage a child's individualized education program, or IEP. They may require more documentation or new assessments, which can add additional stress for parents. Another common stressor for military families: deployment and temporary duty. When a service member is deployed or temporarily assigned somewhere, they can be away from their family for months at a time, leaving the spouse responsible for managing the child's medical and educational needs, finding childcare, and navigating any unexpected medical, educational, or financial challenges. If the spouse is also on active duty or has a full-time job, it can be overwhelming. Understanding these challenges can help you connect with military families and provide them the right support. Your expertise and knowledge of community resources, local schools, and information about special education in your state can make all the difference. To learn more about assistance and resources that you can tap into to help military families, visit militaryonsource.mil/special-needs or see our other videos in this series. And as always, thank you for helping the military families who serve our country.